Brown Buffalo. Look both ways before crossing the street. Floss all your teeth before you go to sleep. Otherwise, toothaches break your whole damn bank. Fixing your face, that ish ain't cheap. But HIV and AIDS, man, that's for life. HIV and AIDS, girl, that's for life. Ain't no pleasure in the world worth that sacrifice. Spreading it around just ain't nice. Gotta put a condom on like a seatbelt daily.
Why do you think it's important to talk to youth about HIV?
Because it's a lot of youth that's having unprotected sex and doing things like drugs and stuff.
Because it's preventable. Everything's preventable if they understand how to take care of themselves.
You can have HIV and protect yourself.
Welcome to Positive Living. Today we are going to test our 3 contestants' knowledge on HIV. On hand we have experts who we can go to for additional information. Okay, contestants, are you ready?
We are ready.
So we are going to begin our show with the first and most important question. What is HIV? Okay, Vidya, let's hear your answer.
Fungus?
Oh, that is incorrect, but let's see what our experts have to say.
HIV stands for the human immunodeficiency virus, which weakens the human immune system by attacking T cells. T cells are crucial to help fighting off infections. The HIV virus locks onto the T cell, enters it, multiplies, then later destroys it, which makes the body open to infections and even cancers. Without treatment, T cells can drop to a really low level, which can cause HIV to turn into AIDS.
Excuse me, well, isn't HIV and AIDS the same thing?
That's a great question. Let's see what people on the street have to say about this.
HIV is more severe than AIDS. AIDS is something that they can kind of cure, but with some medicine, but not surely.
AIDS is the beginning of the cycle, and then once it like evolves or something like that, it becomes HIVs. That's what I'm not sure on that.
HIV is, AIDS is AIDS, HIV, okay, how do you define HIV?
Most people tend to get HIV and AIDS confused, but they are different. HIV only weakens the immune system, whereas AIDS is the condition in which the immune system begins to fail and leads to life-threatening infections. Within a few weeks of being infected with HIV, some people develop flu-like symptoms that may last a couple of weeks, but others may have no symptoms at all. Since the symptoms of HIV are not always detectable, people living with the virus may appear and feel healthy for many years. But besides feeling and looking healthy, HIV still affects their body, and that is why people need to get tested for HIV.
Thanks for that information, Dr. Brown. And the next question is, how is HIV transmitted? Okay, Malcolm, you're up.
Well, HIV is transmission by having unprotected sex or sharing the same needles.
Your answer is right. Let's see if our experts have anything to add.
HIV is primarily spread by having unprotected vaginal, anal, and oral sex, sharing needles and syringes. However, HIV can also be transmitted to newborn babies born to an infected mother. Blood-to-blood contact, having risky behaviors increase the chance of getting the virus as well. For example, having multiple partners. Let's say you sleep with your partner and he or she has slept with at least 2 other partners. That means that you have been sleeping with 3 people. And if those people have slept with 2 partners, that means you are sleeping with 7 people in total, all at once. The more partners you have, the greater chance of you getting the virus.
Next question. Who can be infected with the HIV virus?
HIV can infect drug users and prostitutes.
Oh, that is incorrect, but let's see what our experts have to say.
Even though some groups have higher rates of HIV in their communities, doesn't mean that they are the only ones who can catch the virus. Anyone can catch the virus. Anyone who is sexually active is at risk of getting HIV. Some activities like unprotected intercourse and anal sex put you more at risk, and it only takes one time of being exposed to catch the virus. Sharing of needles can be very dangerous, but drug users aren't the only ones who use needles. Getting a tattoo can also be risky. Make sure new, clean needles and ink are used before getting a tattoo or piercings. Everyone is capable in spreading the virus, including celebrities such as Magic Johnson, Roy Simmons, and Tommy Morrison, who all have HIV.
Okay, it's time for the next question. Name 2 ways that HIV can be prevented.
By using a condom every time when you have sex.
Do you have another answer?
I don't know.
Would another contestant like to take a shot at it?
I will, by not sharing needles.
Great. So let's move on and see what the expert has to say about this.
Well, there are several ways to prevent HIV. Begin by knowing your HIV status, have safe sex, limit your sex partners, practice abstinence, meaning don't have sex at all, don't share needles, educate yourself and others about HIV, make sure to communicate with your partner about having safe sex, and be sure to know your partner's HIV status.
Great, Dr. Tran. Now let's take a look at how a responsible couple communicates before having sex for the first time.
So did you go get tested?
Tested for what?
What you mean for what?
Oh, you mean the HIV thing?
Yes, the HIV thing.
Come on, I know I'm HIV negative. Besides, you know me. Why should I go and get tested? Don't you trust me?
I do trust you, but we have to make sure before anything happens.
Okay, I have a condom for today. Can we go and get tested tomorrow?
Stop, I already told you we have to get tested before.
Okay, fine, you win.
Okay, I'll make the appointments later.
Later? Why it can't be right now?
We still have to wait for the results anyways.
Come on, that's too long.
Either that or bye.
Okay, I'll do it, because I love you.
Excuse me, host, I have a question. What happens to a person if they're HIV positive?
Thanks, Jyoti. That's a great question. Let's see if someone outside the studio has an answer.
If you are HIV positive, you can still live for many, many years. Even though there's no cure for HIV, medicines are becoming more and more advanced. Beginning treatment early increases your chances for a long and healthy life. Current medications can dramatically improve the health of people with the virus and can prevent HIV from developing into AIDS. The medicine also reduces the ability to spread the virus. See the importance of taking a medication if you are positive?
This is the last question, and it's the bonus question. Whoever gets this right will win the grand prize. What is the most important method of prevention?
Testing.
That's correct, and that's actually what you've won. Free HIV testing.
Getting tested for HIV is the most important method of prevention and can save your life. You don't need your parents' consent for an HIV test, and it is completely confidential and private to the world. If you are sexually active, it is most important to get tested every 3 months. If you think you have been exposed to the virus, get tested now and then again in 6 to 12 weeks. Taking preventative medications as soon as possible after a known exposure can also prevent infection. You can be tested through blood or saliva, and some tests can even give results within an hour. Ask your doctor what is available at your clinic or the emergency room. If you are HIV positive, then you should talk with a doctor about all possible treatments. And if you are HIV negative, finding out can be a really big relief, and you can learn how to remain HIV negative.
Now it's your time to get tested and spread the word.
Look both ways before crossing the street. Floss all your teeth before you go to sleep. Otherwise, toothaches break your whole damn bank. Fix your face, that ish ain't cheap. But HIV and AIDS, man, that's for life. HIV and AIDS, girl, that's for life. Ain't no pleasure in the world worth that sacrifice. Spreading it around just ain't nice. Gotta put a condom on like a seatbelt daily. HIV your baby, all for being lazy. No babies are mistakes and most are cute, but a father ain't a guarantee and babies need loot. As for HIV, you gotta go check. Better know than not know, it's much less stress. And even if it's HIV, at the end of the day, you got many more days to do what you say. Look both ways before crossing the street and floss all your teeth before